All right, well, thank you so much for having us present today. So we are going to be presenting about Atrius Health's clinician leadership development. My name is Kareem Awad. I'm a physician at Atrius Health, and I am the medical director of clinician wellness. Diana?
Hi, I'm Diana Dill. I'm a coaching and consulting psychologist, and I had the pleasure of developing this program for Atrius Health.
And hi, I'm Les Schwab. I'm a primary care physician and a coach. I've spent half of my career in positions of leadership and know the importance of leadership in promoting the well-being of an organization, and glad to have been part of this project.
All right, well, thank you so much. So let me move on to the next slide. And so just a little bit of background about Atrius Health. So as you may know, Atrius Health is a large outpatient multi-specialty group, and we're a value-based organization. What that means is that we are focused on high quality, low cost care. And we have about 750,000 patients in the greater Boston area and about 30 medical practices as well. And we're very strongly primary care focused as well. And just a little bit background before we delve into it about burnout in general. As you may know, this is the national surveys that have been running for close to a decade. That are run by the Mayo Clinic, and they have been measuring physician burnout over the last 6 or 7 years, comparing it to general population burnout as well. And you can see the physician burnout has sort of oscillated a little bit, but consistently it has stayed above the general population. And if you look at actually the entire healthcare team, every person on the entire healthcare team has a higher rate of burnout compared to the general population. And this matters because not only does it impact the clinician's quality of life, but organizations have realized that it actually impacts patient outcomes. There's increased patient complaints, there's increased risk of complications, including mortality and infections, if you are cared for by a burnt out clinician. And there's also implications to the bottom line for organizations in terms of turnover and FTE reduction. So this is something that's super important that needs to be addressed across the spectrum. And sort of just a quick review about what we've been doing at Atrius Health, or specifically our sort of burnout range. And so we've been measuring this for the last 3 years and been working at it for about 4 years. And originally we were around the level of the national average, and there has been some decrement or decrease in our levels of burnout. And we measure both in our physicians and our APCs as well. And the way we do this is really by using the Stanford model. You may be familiar with this, but the Stanford model really emphasizes the organizational aspects of how do you reduce burnout and improve well-being. And specifically, it focuses on the culture, and this is what we'll be talking about today, about leadership, the efficiency of practice. And what that means is really working at the top of your license. And personal factors, so what's considered personal resiliency. And really the overall goal is not reducing burnout, but improving professional fulfillment. And so we have a suite of programs within our department and within our organization. And we're not focusing just on one piece of the pie. It really is important to focus on all of it as well. But today specifically, we're going to be talking about a program that Diana developed called Coaching for Clinician Engagement. So Diana. Diana, you're on mute. Yeah, perfect.
So we were among the many different programs we've developed to try to address physician burnout. We have been really impressed with the power of managers, the clinician chiefs, to affect the well-being of their teams. We know that across industries, the way managers treat their employees predicts their satisfaction, their retention, their performance, and their well-being, as well as predicting the organization's profitability. In medicine in particular, at the Mayo Clinic, they showed that physicians who had managers who treated them in a certain way were more satisfied, more engaged, and less likely to burn out. This style of management, the Mayo Group termed participatory management, physicians were more satisfied and less burned out when they said, my manager empowers me to do my job, listens to my opinion, recognizes a job well done with praise, and coaches me to do my best. This This participatory style of management we can think of as managers engaging their reporting physicians and APCs as collaborators rather than using an authoritative or a hands-off management style. Now, participatory management is not straightforward or easy. It's more complicated than the authoritarian or the hands-off style. We think it ought to be learnable, however. And if the participatory style has such benefits to the medical workforce, shouldn't we try to intervene and teach it? So we asked ourselves, can we teach physician leaders and managers a compact formula for participatory management that will be enough to produce an observable shift after 6 months? And will it be enough to impact clinical staff well-being? And will the learning experience impact managers' well-being as well? Next slide, please. So we developed an experiential training program that had 2 key components. One was a didactic, given once in 2 hours, another time in 3 hours. And the second was coaching, one-on-one coaching for clinician chiefs. The experiential training program introduced physician managers to key tools drawn from the coaching world. We thought that these tools could be our compact formula for teaching participatory management. We taught them how to promote an emotional connection with the physicians who reported to them, to create an environment that was psychologically safe for them to participate fully, to empower them to address problems and make decisions, and to help them feel optimistic that they could create change. This is a brief summary, and you can see more detail in our poster that we presented at the American Conference for Physician Health on the website, workingtogetherforhealth.com, on this slide. Okay, we then went on to augment the formal training with 6 one-on-one coaching sessions with an experienced physician coach for each chief. In the coaching meetings, they set personally meaningful goals for how they wanted to develop as a manager. They practiced these coaching skills, and they used the sounding board and input of their coach to sort out other management issues and develop the skills they need. Les will tell you a little bit more about that in a minute. Next slide, please. Here's how we evaluated our program. And again, if you'd like details, go to our poster on the website, workingtogetherforhealth.com. All departmental physicians and APCs were asked to complete an anonymous online survey before and after the program regarding how participatory was their manager's behavior and also their own fulfillment and burnout at work. In addition, the managers reported to their coaches at their first and last coaching meeting their success to date accomplishing each coaching goal, and they debriefed about their experience of coaching at the final coaching meeting. Les will tell you more about that. When the results of evaluating our program showed promise, although we need to bear in mind we weren't able to conduct a rigorous RCT. With regards to our first question, can we shift managers' behavior to be more participatory over 6 months? Yes. Department scores shifted by 2 points over 6 months. It may seem like a small difference, but the Mayo group who originally studied participatory management showed that only 1 point of naturally occurring difference predicted a significantly less burnout and significantly greater fulfillment. Next slide, please. Our second question, will the shift to a participatory management style improve departmental well-being? Yes. Results suggest that shifting managers' styles can result in greater well-being in their reporting clinicians, in that fulfillment among the department clinicians improved. We did not, however, see an improvement in burnout. And there are many possible reasons for this that are discussed in our poster if you'd like to follow up. Next slide, please. Our third question, will the shift to participatory management plus the experience of coaching in general improve managers' well-being? Yes. Fulfillment improved and burnout decreased. Plus, as Les will tell you, chiefs reported improvement on most of their coaching goals. Les?
Yeah, thank you, Diana. So I'd like to describe the coaching process in some detail. The first meeting between the chief and coach was used for individual introductions and to map the coaching process going forward, and thereby creating an alliance between the coach and the chief and setting goals for the engagement. The goals chosen are grouped thematically here. Excuse me. Goal setting began by giving each chief a report, as Diana said, based on the Mayo criteria of their own clinicians' ratings of their participatory management style, and they were asked to reflect upon it. They were also asked to think about their areas of leadership strength and also what areas would be opportune for their growth. From there, we established a few set goals for our work. The core of coaching is indeed the establishment of client-centered goals. Accordingly, our chiefs sought help on a broad range of goals. For each chief, those that were most salient and timely. And as shown, we covered a broad range of them. Coaching proceeded on a monthly basis over 6 months. In subsequent sessions, after catching up on interim events, the chief provided a session focus, usually a specific instance of one of their overall goals, now calling for proximate action. The situation was described, reflected upon for both opportunities and resistance, and action steps chosen. These would be reviewed for insights at the beginning of the subsequent section. Next slide, please. Excuse me. And we did add an internal subjective measure of success, one that has been validated in the literature. For each goal, the chief rated their percent goal attainment at the outset of the coaching engagement, and the same goals were rated as percent success at the conclusion. Next slide. And indeed, we saw reasonable success in the attainment of their stated goals, with percent success rising from 49 to 67% for all chiefs, all goals combined. Of note was the application of the participatory management skills to situations other than supervision, although supervisory conversations was the original model for their use. The framework proved remarkably flexible, not only for the original managing down supervision situation, but also managing sideways with peer nursing and administrative leaders in their departments, managing across to other sites and specialties, and managing up within their own leadership hierarchies. Next slide. We also asked the chiefs what they thought was the value of the coaching experience for them, and the themes for their responses are collected here. We were pleased to see that indeed the specific skills were emphasized in both the didactic and coaching parts of the program and were acknowledged, as well as the coach's assistance with specific goal completion. But these responses also show us something about the personal experience of coaching and how it differs from ordinary, straightforward skills training. The chiefs perceived value in having an available and empathetic ear, in taking a time out for reflection and clarification, in having a companion to volley ideas with, and to be able to use a supportive form of accountability to help hold them to their chosen path. Altogether, these constitute an opportunity rather different than their usual modes of work, and it was roundly appreciated. Kareem.
Thank you so much, Diana and Les. So just in summary, basically this small pilot has shown that we can improve the participatory management skill set of chiefs, and specifically 6 months of coaching helped reduce burnout and improve fulfillment in chiefs, helped improve fulfillment in direct reports, and allowed chiefs to attain important management goals. So thank you so much for allowing us to present.
Thank you.
All right.
Okay.